speaking with TAYLAH Arnold, and I work at Geelong High School as one of the alumni program coordinators, and I've been lucky enough to meet TAYLAH at a couple of times at school since she's left. TAYLAH was graduated in 2016, and she was a school captain that year in Year 12. And my understanding is that TAYLAH enjoyed school, learnt a lot about herself, let alone the various things that she had to study. And while she was at school, she decided to undertake a nursing degree. So that was her goal. Then she left Year 12, got into uni to do nursing, and has been out for about a year or grad year plus 1 year. And so now has had 2 different nursing roles. So she is what we consider to be an early career professional in the health sector. So today, TAYLAH's left, given us some time to talk about what it's like to work in health in Victoria. Hi TAYLAH, how are you?
Good, how are you going, Zoe?
Good, thank you. Can you tell us what you did what subjects you studied in Year 12?
Yeah, so in Year 12, I did English as you have to. So I just did plain old English. I did further mathematics. I picked up bio in Year 12, which was a bit more than I could chew, but it got me to where I needed to be. I also did business management and vet dance as well.
And what motivated you to aim to study nursing after you'd finished Year 12?
I think I was introduced to nursing through sort of personal avenues. So my mum and my grandma had undergone major surgery, and they spent a lot of time in hospital. So while I was there visiting them every day after school, because Geelong High is nice and close to the hospital, I got to know a lot of the nurses and got to see what they did. I've always been the kind of person that wanted to help others and try and improve the life and quality of life of other people. So it was something that really resonated with me. But it was interesting because up until a week before the uni preferences closed on, I think it's BTAC or whatever it is, I had teaching as my first preference. So a week before I switched to nursing, and it worked out in my favour.
That's interesting. And what was it like doing the nursing degree itself for those 3 years?
It was challenging. I liked school and I liked studying. I liked to push myself academically at school, but in uni it's a whole different ball game, which I know teachers talk about all the time in VCE. But it really is, it's very self-motivated. You need to make sure that you're doing things and you're keeping track of your timelines, and you're making sure that you're actually making the effort to go to class. The academic side of it I found quite challenging. But when you got out to placement at the end of the semester, that's what made me think, yep, this is right for me. I can get through these 3 years of study. And I did. So that was sort of what got me through each semester.
Well, that's fantastic. And I understand nursing, you need to do a grad year, and you did that at the new hospital in Geelong, the Epworth Hospital. What was it like, the grad year, compared to the uni academic study?
Most of your learning's done in your grad year, I'd say. You spend 3 years learning at uni and 1 year on the floor learning as a grad year, and that first 6 weeks is a massive learning curve. You pretty much you're very well supported, but you're pretty much thrown in the deep end because that's the best way to learn. Like I said, well supported, you've got backup there if you need, but you just need to throw yourself in and give everything a go while you're in your grad year, because that's the best time to do it. You've got that backup, you've got that seniority above you to be able to, like, oh, she's a grad, I'll help her out, you know, with new procedures and complex patients and things like that. But yeah, you learn so much in that first 6 weeks especially, but the whole 12 months, most places you'll do 2 rotations in your grad year, so you get to try 2 different types of nursing. Some places it's 4, so 1 every 3 months. But it's, yeah, the massive learning curve. All your learning's done on the job for nursing. It's a very practical career, very hands-on. So that's on the ward anyway. So that's pretty much where you do all your learning.
Okay. And you ended up on the general medical and oncology ward, which I understand could be a pretty pressure situation, especially when people are very sick, and it also involves some end-of-life nursing. Can you tell us about that kind of nursing? What does it mean to be in an oncology ward or an end-of-life palliative care situation as a nurse?
You need to have pretty thick skin, I think, and a pretty good relationship with the idea of the circle of life. It's pretty confronting. So you're seeing patients come in for their first sort of admission to hospital for their chemo, and then you're also seeing them on their way out when the chemo doesn't work. It's really emotionally challenging. When you've got a good team behind you, it makes all the difference. My team was incredible. I think the thing I actually liked the most about my ward was the palliative and end-of-life care. That was something that really resonated with me. I wouldn't say that I have a great relationship with death and people dying, but I think my goal was to make sure that the people that were passing away and their families weren't scared, because that's the hardest thing, is watching your family member pass away and just trying to keep them as comfortable and as cozy and warm and loved as possible, especially during COVID. So it was quite challenging. You could only have 2 family members in at a time at the best of times. So a lot of the time we were the ones there at the end. So you just want to provide as much love as you can. And yeah, it's pretty incredible to be on that journey with people and their families. You feel pretty privileged to be a part of that and to care for people when they're getting towards the end of their life. It's pretty amazing.
That's amazing. It is amazing, and I could imagine you would be wonderful at it and make a really big difference. And I gather that you've actually changed jobs into the other part of the circle of life.
Yes.
And now that you've taken on a new role working at Monash IVF as a fertility nurse.
Yeah.
Can you tell us what that job is?
So IVF nursing is vastly different to what I was doing, and it's different to ward nursing, sort of generally speaking. It's a lot more autonomous, so you sort of are directing a lot of the patient's care. A lot of it is you get very well in touch with the female cycle and understanding all the hormones that go into producing eggs and sperm and how they all work together. A lot of it is interpreting blood tests and scans and passing on messages to doctors and just sort of being that liaise between the patients and the doctors, because there's I think the stats are something like 1 in 6 couples need fertility help. So it's a very busy industry, that's for sure. So the doctors are seeing lots and lots of patients, and we're sort of their first port of call for any questions or advice that they need. And we assist with sort of demonstrating education about their medications and what to expect from each cycle, and then sort of towards the end, if they are successful and have embryos, we help transfer them back with their specialist, which is really lovely, and giving them the phone call to let them know if they're pregnant or not, which can be challenging as well.
Yeah, I could imagine. Is this also based in a hospital, or is it at a sort of a more of a medical rooms situation?
It's more of a medical room situation. The patients that are going through IVF specifically will go to a day stay hospital at some point during their cycle, but otherwise it's all managed in the rooms.
Okay. And so does that mean that you used to work in a hospital and now you work in a rooms? What's the difference like for you in a workplace and a personal enjoyment of different workplaces?
I'm finding it really nice to have my weekends back, and being able to predict what I'm going to be working hours wise. I think it's important to recognise that when people talk about doing nursing, you always think about nursing on the ward, and that's not true. If you do nursing and you find that the ward isn't for you, don't feel bad. It's not for everyone, and I'm still undecided whether I love the ward or whether I hate the ward, but it's just different for everyone, and there's so many different options. You don't have to be a ward nurse. You can go into education, you can go into managing, you can go into drug representative, you can sell products to hospitals and demonstrate how they work, you can do IVF, you can do practice nursing. There's so much, and I think actually someone in my year level, their sister did nursing, and they said to me when I was in year 12, you know, you don't have to work on the ward, you can go somewhere else too. So now I'm trying a little bit of both, and it's really interesting to see the differences. But like I said, it's really nice for a work-life balance if that suits your lifestyle.
Yeah. Do you think that having some time on the ward is a good idea for a nurse?
Yeah, absolutely. Yeah, you learn a lot about who you are as a nurse and what ward nursing is about. You can't say you don't like something if you don't try it. I would recommend everyone do an acute grad year if you can, just so that you can get that experience behind you. It teaches you a lot about developing relationships with patients and doctors, because in some wards it's a very quick turnaround. You sort of got your patients for 2 to 3 days and then they're out home and doing outpatients and things like that. And just problem solving as well. On a private hospital, there's not doctors available all the time. So you're sort of learning to build those communication bridges with doctors and building rapport so that you feel comfortable talking to them, because it can be intimidating sometimes talking to doctors. A lot of them are so lovely, but sometimes they're, as I said, really busy. So it can be hard to get your point across when they're not there all the time.
Yeah, I could imagine. And you'd also have to have a whole other language, clinical language, that you would need to be really confident in speaking with and in. Do you feel like that's improved over these last 2 years of your experience?
Yeah, it's especially when you're delivering bad news, I think you learn that pretty quickly, what to say and what not to say. And it's important to be able to distinguish between the conversations you should be having with the doctor and the language you're using with the doctor, as opposed to the patient and their family. You can't use medical terms with patients and families. You need to be able to explain things so that they can understand it and so that they know what they're in for, especially in cancer treatment and end-of-life care. And also there's language barriers always in any job. So you've got to manage those barriers as well.
And I guess at the moment, obviously with the COVID pandemic still rolling out here in Victoria, there are lots of calls for nursing and medical staff. Would you encourage current students to think about working in health?
Absolutely. You know, it's a career. You're never going to be out of a job. You are always needed, whether you're a nurse or a physio or a doctor or a pharmacist. Health is something that is so multifaceted. It can take you anywhere in the world. If you have dreams of traveling, get yourself a health degree under your belt, and you can work overseas and do that as well, for however long you want to stay. It's pretty incredible. And like I said, this COVID times have shown that anything can happen. People are going out of jobs every day, and I feel especially grateful, especially during this time, to have a stable job and have been given the opportunity to even change jobs. But health is something that you're never going to be out of work. You're going to be able to take it with you everywhere, and it's a handy skill to have, especially at home. You know, someone hurts themselves, you're able to help out. Little things like that. It's just nice to have that knowledge under your belt as well.
Well, Taylah, that is so great. It's been wonderful to see you again for me, and I know that a lot of the teachers at Geelong High School will be so proud of you, having seen you grow up at school and now know that you are doing this really important work in healthcare in Geelong. So a big thank you from all of the staff for everything that you do towards our communities, and I hope that you really enjoy your IVF nursing experience. We'll talk another day.
Thanks.